In this video, I want to talk about Social Security and my experiences with it. After becoming uninsured and unemployed and becoming seriously ill and ending up in the hospital and my wife passing away, I ended up, after being referred by a family member, applying for Social Security survivor's benefits, which are the only reason why we're not homeless or going hungry and not on the streets, essentially, and we're able to pay at least some of our bills. The truth about Social Security is that it does not pay anywhere near enough to live on. In my household, there are 3 recipients of the benefit receiving the maximum amount that we could qualify for under the survivor's benefits. We get cost of living adjustments, but it doesn't keep up with the cost of things, and we're not able to buy anything as far as things that people would like in terms of gifts. If you have children, for instance, stuff for the birthdays, for Christmas, I can afford to buy clothing for the children, but I've seen what we had prior to ending up on Social Security dwindle because our income did decrease substantially after my wife died and I lost my job. It's not enough to pay all the bills at any time. Immediately after ending up on Social Security, we began the process of being victimized worse than we ever have been before in terms of the outcomes that we were dealing with. We were making just enough on SSI not to qualify for outside assistance with things like legal help. And it's tragic because you have just enough to survive, barely, but not enough to improve your situation without taking out some kind of a loan or something like that. And basically, you really have to go back to school and go into debt in order to have any kind of chance of bettering your situation. It's pretty difficult these days now to get a job in which you are making enough money without an education to sustain yourself. And as a single parent, most people, they don't have child care. They don't have a lot of the time family, in my case, that they could depend on, which I don't have. I don't have people I can depend on as far as family goes. And they end up just trying to make it, essentially. Gradually, as time progressed, my mortgage company, the mortgage servicer, banks, credit card companies, lenders, and retailers began using our disadvantaged financial status to place us with subprime interest rates and to take everything we had worked for. They knew that we were so at risk financially that they could pretty much do whatever they wanted to, and most likely they would get away with it. And that is exactly what most of them did, too. And they called it just business. We ended up in wrongful foreclosure, being burglarized, threatened after reporting it to law enforcement, being turned down for any amount of credit at all, even secured lines of credit. At times, we had very few food options because simultaneously the pandemic had just started. And we even came pretty close a couple of times to being completely homeless. Our status was not our fault, but that did not make any difference. We lost just about everything. This is not a metaphor at all. I ended up with so little that we could fit most of everything in the back of 2 pickup trucks at one point. We could not afford our utilities, and there were things, sometimes I had to rob Peter to pay Paul, as it were. Basically borrowing from one expense and skipping paying that expense for a month or 2 months even in some cases, in order to make sure that we could meet other needs that came up emergently. And we had penalty fees that were applied to accounts because we were late. It wasn't that I wasn't good with money, it's that we weren't getting enough to cover everything. Ending up on Social Security was kind of like being on the ship of the damned. I think you can kind of imagine what I'm talking about if you have experience with it or you know someone who has. If you do not have family or friends to depend on, you're going to have to work really hard to improve yourself in your education so you'll have better employment opportunities or better prospects in terms of ways to generate income and revenue, to bring money into the house. I checked to see what help was available and I applied for a lot of different types of assistance, but very little or nothing came through. We've managed to get food from food banks twice. What I found out was that most people on Social Security end up living, if they're alone, they end up living either with other people who are also on Social Security, or they end up homeless, living on the street while collecting Social Security benefits so that they can eat and at least wash their clothes and maybe occasionally get a hot shower. For most of what they need, individuals, and especially individuals with children who are like I am, widowed, depend on the charity of other people and charitable institutions. And you often see them begging at intersections or holding up cardboard signs. If things get truly bad, some of them will commit crimes in order to get arrested so they can go to jail on purpose. I know that sounds really crazy to some people, but my grandmother used to joke about throwing a brick through a jailhouse window if things ever really got bad, so that they would give her free room and board. I know that's really something. It's not something you really want to laugh at, but she get paid housing with air conditioning and food, 3 meals a day, a shower, free medical care. It's crazy because inmates in jail are afforded more privilege and more rights than most people on Social Security get outside of jail. That's nuts, isn't it? You have to become, what do you call it? You have to go into state custody, essentially, in order to get the kind of care that inmates get. That's tragic. And it's sad. It's really sad. But in jail, they receive housing, food, laundry service, medical care, and air conditioning. And they also get phone calls. They're able to learn, and their education is paid for. They have access to a library and the internet in a lot of cases. I'm not saying it's something that you should plan to do, but a lot of poor people end up doing that. Not on purpose, but inadvertently when they end up incarcerated on account of the poverty that they exist in and the desperation that it puts them in. They end up benefiting from some of those classes and so forth, things they have access to in jail that they wouldn't otherwise have access to outside under normal circumstances. Being in jail is awful. Don't get me wrong. I've heard stories from members of my family who spent years incarcerated. But being homeless and living outside, in some cases, it can be much worse. Because you're exposed to the elements, you don't have running water, you don't have regular access to toiletries and toilet facilities or showers. You don't have access to state-sponsored, medical care, even though it's probably not the best quality of care that they get in there. It's better than what most uninsured adults have access to outside of jail. Which is, again, sad. I can't even begin to tell you what it is like living outside when the temperature is 120 degrees for weeks on end. It is really awful. It's like you're living in hell. I've seen some of the people who don't have access to a shower. I've smelled them from a distance. I'm not criticizing, but it's so sad because these people end up so desperate. And a lot of them, as I said, they're collecting Social Security. They're only getting about $700 or $800 a month to live on from the government, and that's what they expect you to live on when you're a Social Security recipient. It's just terrible, especially if you're somebody who's suffering from really debilitating disability or mental illness and you don't have any family to depend on. Most of the time, these people end up pushing a cart down the street that has all their material possession in it, and they're, if they're really unfortunate, they don't have access to housing or shelter or clothing or, laundry facilities or bathing facilities, and most of the time they end up dying of exposure. That's what kills them. Either the extreme heat causes them to have a heat stroke, or they freeze to death when the winter comes. The poor are often entirely without fault in how they got into these situations. Again, referring to institutionalized poverty and the consequences of being in an at-risk, housing insecure situation because of the familial circumstances or otherwise that they're coming from. People think when they see these people that they have not worked hard enough to get out of the circumstances they're in, but some of these people worked extremely hard. What happened is that they gave their all, and because they couldn't catch a break, their circumstances broke them, and they finally just gave up, and they accepted a substandard quality of life because they became severely depressed or had some kind of mental health crisis in association with their circumstances, and they just got beat down to the point where they felt they couldn't get up anymore. It's not that these people are what you would call bums or that they don't want to work. That's not it most of the time. It gets to the point that if you're not making a certain amount of money and do not have housing, it is more detrimental to you to have just any job than to get a job that pays enough for you to live comfortably. Now, oftentimes, these people might even work 2 or 3 jobs before ending that situation. And just the right circumstance comes along that they can't make ends meet anymore. And they're knocked down to a point that they can't recover on their own, not without outside assistance. When you have children, it's even worse because you have to pay for child care, and there's a whole bunch of other financial requirements that are put on you. I'm not saying that you shouldn't have children, but it's so much more difficult when you're poor or poverty-stricken or financially at risk and you don't have sufficient income, and then you have the children, and it puts you and the children under even more financial stress. You have to have a support system in place, which a lot of these people don't have. The poor often achieve a condition in which they are obligatory criminals. That is to say, because they are so poor, they commit crimes because they are unable to pay to adhere to legal requirements and costs placed on them by the government and society. I've referenced this before, having to pay for car insurance, registration, inspection, and government ID renewal. These are just some of the costs. And there's other state mandated costs that I'm not aware of, probably, that I haven't even referenced here. I'm probably going to learn about more of that later on, but parking fees, for instance. If you have to pay for parking in the major city that you work in, if you happen to work in an area like that. Because these people live in abject poverty or deep poverty, they have to choose between buying an essential that they have to have in order to live, like food or water or electricity, or paying the fees for some costs that they are obligated under the law to shell out. By the time they reach this level of poverty, they have been excluded from almost all levels of the economic exchange. At this point, they are so poor they become what the ignorant and heartless people would call a burden to society. And I'm not saying that that's what they are. But that's how a lot of the affluent and the extremely wealthy refer to these people. It's not their fault. It's not. Most of the time, they tried really hard. It's a tragedy, is what it is. They end up as obligatory welfare recipients, and they are so deeply trapped in their circumstances, in poverty and in illness, that they cannot escape from it at all at that point without a large amount of outside help. Somebody has to help them usually to get transportation, to get a decently paying job, to get them vocational skills so that they can participate in the exchange again and have some degree of quality of life, even if it is limited quality. Even if they are able to work, the odds are sharply out of their favor that they will ever be able to return from living well above this condition to a state of full self-sufficiency. They're always going to have probably some measure of dependence on the system. And it's not that they want to depend on the system. It's that it's very, very hard to climb out of those circumstances once you've lost everything. We've been fortunate because we at least have enough coming in between the three of us that we don't have to depend on anybody else most of the time. But when we get a really high utility bill or something like that, we usually have to make payments in order to pay them down. We might not always be able to pay our monthly utility bills. And services have had to be cut because we couldn't afford to pay for everything. Most people would use the turn of phrase that under normal circumstances with outside people not helping, which is most of the time what happens, these people, that really end up desperate, they are literally living on the donations that are getting cash in hand from people with intersections and things like that on a daily basis. They might be living from day to day, unable to save anything if they're not getting any support. And most people would use the turn of phrase that they're fucked. I hate to put it that way. It's very crass and to the point. But these people, they aren't getting the assistance that people say is out there. They're not. When you go to depend on those social safety nets, they're not there. I'm telling you, they're not. I know because I tested the system. And I ran around, not like literally ran around, but metaphorically, making phone calls and sending letters out to people. And even with a lot of extenuating circumstances and having young children, we were not able to garner support from most of the places that I checked with, including United Way, the Red Cross. There were a bunch. 211. Some of the people were even rude to me when I talked to them. I told them, look, I've already tried that resource. They haven't helped us. What should I do? Well, I don't know, sir. It's just my job to disseminate this information. That's what I was told by one lady. And, I don't take it personally, but at the same time, if this is the experience that everybody that's seeking help is having, then why even bother having those institutions? If they're just, most of them, I'm not saying all of them are doing this, but a lot of them, they're getting government funding and they're being sponsored by private sponsors. Yet, if a single parent is going to them for assistance, particularly if it's the father and the mother has skipped out or she has died, through some tragedy, those single parents, more often than not, especially if it's the father responsible for the children with no outside help, they're not getting assistance. They're not. And so, what I'm saying is that, we need a minimum income that everybody's given. I'm alluding to that. With all this, we need a minimum income that everybody's given. If you make less than a certain amount, then you're just not making it. You're not. And you can't better your circumstances without going into debt, or taking a significant chance where, maybe if things don't pan out, you might potentially worsen your situation without meaning to. And what I've learned is that you have to live very, very small when you're getting very, very little. It's not that you want to, it's that you do so out of necessity. But Social Security does not provide the measure of protection or financial capacity to survive. It doesn't. And anybody who operates under the illusion that people who are fully dependent on Social Security are leeches, or that they choose that life, they don't know what they're talking about. Sure, there are some people who don't want to work. I understand that, but there are a lot of people too who worked their asses off, and they still ended up, in a very bad situation because of, other people's decisions, because people who saw they were vulnerable took advantage rather than helping them. And that's what's going on out there. In the bulk of the situations that I've observed, people get what they can off of you, and then they basically kind of just leave you for dead. And they say, oh, it's just business as usual, I'm just capitalizing on the situation. Well, if that's what it means to be a capitalist, that's the definition of evil. It is. Really. We need to overhaul the social welfare system. Instead of victimizing the poor and victimizing families that are in at-risk financial circumstances, they need to be giving those people payments. Because it's stupid that, your children, say your children get taken away, for instance, okay? They're going to give monetary payments upwards of $1,000 a month per child to this foster family to take care of those children, each one. Whereas if they're with their biological parent, they don't get that assistance. Does that make any sense to anybody? That's kind of screwed up logic, because if they offered them that assistance in the first place, the parents who are in the situations where their children ended up being removed would probably not have to have a removal done. They could improve the situation, pay for child care, pay for things that they needed for the kids, or rectify the circumstances and have their financial stresses alleviated, which is a lot of the time what precipitates the circumstances that bring about a condition where there's people are so stressed out that there's domestic violence and things like that going on. It's ridiculous, because the harder that people work to be independent of the system, the more the system tries to set you back. And people, they work hard for a long time, and maybe for 20, 30, 40 years they have it really good. But then it gets to the point where they can't continue to withstand the adversity that they're facing from a financial standpoint. And their house starts to fall down around them. They start to have, all these expenses that they can't overcome. And so in their old age, if they don't have children to take care of them or other family to help to maintain their quality of life, they end up having to move out of their house. And eventually they end up in a small, maybe even a shared room at some nursing home or something. But people do the best they can for as long as they can. And Social Security, that's like the lifeline for the bulk of the American public when you fall in really hard times. And if that program ever fails, we're going to see the quality of life in this country fall to such a degree that it's going to be really horrible. I mean, we haven't gotten there yet, but the program's not being funded, and the greed in this country has grown to the point where it's really truly a terminal illness. It's like a very bad cancer, and it's strangling the life out of the working class and the middle class to the point that they can't really save anything or put anything back. And when you get to that point, when you get to the point where nobody can hang on to anything except the very richest people, and they're not putting any of their money back into the system to stimulate the economy, and the currency is devaluating, it just starts this cascade. The wealth consolidation creates a cascade, because everything is going up in cost, not because of a lack of materials or supply, but most of it is going up because these people, they feel like, there's always going to be somebody who can afford the price that they're willing to place on things, and it just isn't so. People aren't able to put anything back, and it gets to the point where eventually they become at risk like everybody else, and you've got people who are either very, very wealthy to the point where it's ridiculous, or they're poor to the point where it's really, really sad. But we need to overhaul the social welfare system in this country because it's not addressing people's needs. I applied for Social Security disability when I was critically ill. And I was having asthma attacks, and I was trying to get albuterol. I had some on hand from when I had insurance. When my job let me go, wrongful termination, I ended up going to Social Security as a last resort. And they put me on a wait list more than 24 months long. And in that time, my phone number also changed several times on account of our financial circumstances and our situation. And we had a lot of difficulties. And it got to the point where we eventually had to relocate out of that area. So I couldn't even stick around to wait to speak to Social Security to see if they were even processing my application. But I was hearing about people dying while waiting on them to come through for Medicare. And I didn't qualify for adult Medicaid because we got too much from SSI. But the irony is that even though we were getting as much as we were from SSI, we couldn't afford to buy insurance through the healthcare exchange, even for one of us. So the kids ended up on Medicaid after having private insurance for 9 years. And I ended up on nothing. I became completely uninsured. And when I was able to buy insurance from the exchange, it was so little that we couldn't do anything with it. The coverage was very, very poor. There was no hospital coverage. There wasn't even an ER that we could go to. I think I had Ambetter Silver, I think that's what it was. But I checked around, and the only care that I could get was at a community clinic that was like 35 or 40 miles away. And I went out there, and when I got there, there was nobody in the lobby, and they said the wait was going to be something like 3 hours to see the doctor. And people were coming and going, and I said, man, this is just ridiculous. Is this how it really is? You buy from the exchange and your coverage is so bad that when you go to the doctor, you have a 2 or 3 hour wait at least, and you have no ER coverage, no emergency coverage, and no prescription coverage. And that's what the situation was. And I was reading the reviews, and there were hundreds of reviews for this company, and it was the only one that I could afford. I couldn't afford higher level coverage for $400. I think I was paying $170 a month, not including the copays. But what I found out is that if you can't get employer-sponsored insurance and you end up on Social Security, you're probably not going to be able to get your own coverage, especially if you're making enough between you and the other people in your house that are on SSI to at least pay your rent. I think they said the income cap was like $32,000. But with car payment, car insurance, and communications expenses, cellular phone, renter's insurance, rent, water bill, electric, the list goes on. Appliance payments, if you happen to have to replace an appliance. In my case, we had to replace all of the appliances within like a year or year and a half of each other. The stove broke, washer, dryer. There was a lot of different things that went wrong all in a short time span. And I learned what it's like to be at risk and to have to depend on Social Security. And you exist in a state where It's very easy, if any of the right circumstances hit you, to be set back for years, potentially. And you usually, if you want to get out of it at all, you have to go into debt or take some enormous risk in order to try to better your situation. That's how it is. That's why I say that they need to pay a lot more, and there needs to be universal health care as a human right. And there's so much more that I have to say, but we'll discuss that in some of the subsequent videos. Thank you.